Tuberculosis. Overview of tuberculosis. TB is caused by the bacterium tuberculosis, which usually attacks the lungs, but can also affect other parts of the body, including the bones, joints and brain. Not everyone who is infected with TB bacteria develops the disease. People who are infected may not feel ill and may have no symptoms. The infection can last for a lifetime, but the infected person may never develop the disease itself. People who are infected and who do not develop the disease do not spread the infection to others. Although the TB death rate has decreased by 41% between 1990 and 2011, an estimated 970,000 people died from TB in 2011. TB is spread from one person to another through the air, often when an infected person coughs or sneezes. TB spreads rapidly, especially in areas where people are living in crowded conditions, have poor access to healthcare, and/or are malnourished. Symptoms. The period from infection to development of the first symptoms is usually 4 to 12 weeks, but the infection may persist for months or even years before the disease develop. A person with the disease can infect others for several weeks after he or she begins treatment. The symptoms of TB include general weakness, weight loss, fever and night sweats. In pulmonary TB, the symptoms include persistent cough, coughing up of blood and chest pain. Vaccine summary. Vaccination before 12 months of age with Bacillus vaccine, BCG, can protect against TB, meningitis and other severe forms of TB in children of less than 5 years of age. The BCG vaccine can be anywhere from 0 to 80% effective in preventing tuberculosis. BCG vaccine is supplied in freeze-dried powder, also called lyophilized, form. It must be reconstituted with a diluent before use. It should be given routinely at, or as soon as possible after, birth to all infants except those known to have AIDS or severe immune deficiency. In areas where TB is highly endemic but services are limited, BCG should be given at birth to all infants regardless of HIV exposure. BCG vaccine is not recommended after 12 months of age because the protection provided is less certain.